resolution before the 2020 civil unrest occurred. The resolution was approved on August 4th, 2020. I was chair of the Human Services Committee at that time and felt it was a right time to address equity, ethnicity, and racial issues. And I still believe we need to address it today. Regarding the commission mission, the commission's mission is to realize greater racial and ethnic equity and dismantle racism in Kenosha County.
Given what happened across our country during COVID, don't anyone pretend that that situation is off the table or couldn't possibly happen in America. 6 million forcibly sterilized Americans would beg to differ with that conclusion. Yes, racism exists, but it is not a public health crisis, and our public health department must stay far, far away from anything involving race.
What research have you done and what evidence do you have to support rescinding this resolution? One of the charges of the REEC is to provide data based on research and make recommendations to the county board on ways to improve the disparate incomes for racial and ethnic minorities living in this community. As far as I can tell, the outcomes that were reported in the 2020 resolution on racism haven't improved. Some have gotten worse.
Not take your personal beliefs and use the system to carry them out. This is how the problem of systemic racism continues. So while this commission is sitting here arguing about a name of an award, which Jenny should keep, we got real people out in the community dealing with real things, but y'all in here worried about the wrong things.
If you can't hold the comments to yourself, then citizen comments are right there. Go up to the microphone and speak. However, keep the comments to yourself. Have respectful to the other speakers. Thank you.
I would ask that you consider what it is that you bring to the table. These are tough, real issues that need creative solutions from all sides and viewpoints. So I just wanted to ask that you do use the expertise that you have that brought you to the commission in the first place, and make us proud.
I am from the Deep South, and I remember white-only and colored-only facilities. That was a public health crisis. That doesn't mean that racism isn't a problem today and that we don't have things to address today that need to be addressed. We have to ask hard questions. But using emotional sound bites to get attention, it numbs people to what you're trying to say.
Now, this commission has not been fully staffed for very long, but since it has, what has it accomplished? I suggest all of you get familiar with the mission of this commission and do your due diligence in regards to institutionalized and systemic racism.